Hello, my name is Kathleen Lisson. I am a lymphedema therapist and a board-certified massage therapist. I also teach continuing education courses to lymphatic massage therapists, and I help people after plastic surgery here at my studio in San Diego. So today I want to talk about tummy tucks, abdominoplasty, and kind of compare and contrast the experience of helping a client after a tummy tuck and a liposuction versus helping a client just after liposuction. So the first and most difficult thing that we have to deal with as the massage therapist helping someone after a tummy tuck is the compression that they come in with. Usually they will come in with some kind of garment like this that's an abdominal binder. And the difficulty with the abdominal binder is that it's stretchy in lots of different areas, so it can provide uneven compression. There's definitely some other things that the client can complain about. This Velcro can itch or scratch them and cause them pain, but the big thing usually is this uneven compression. So you can even see it if you see their garment laying down. You will see that it is uneven compression. You can even kind of see this as being an uneven level of compression. So if they've worn it a lot, just because like the way that they're gonna pull it is never gonna be completely even compression. You can see how like this is buckling on the top. So what I will usually do is add some foam to their garment just to kind of give, and the foam will kind of even out that uneven compression as much as it can. But just knowing when they come in, there's no real perfect solution. The surgeon will usually use the foam or use the abdominal binder because they don't want the scar to be affected when it's so soon after surgery with pulling up and pulling down and pulling up and pulling down a garment over the area of the scar and the area of the operation so many times as the client needs to go to the restroom. Another big issue will be the length of the garment. If the client's torso is longer than this, they are sometimes they are either going to have this garment be above the scar, which can put this area as increasing in swelling because all the swelling is being pushed down and then it's going to stop at that scar line. Or if they do get the garment down low enough where it's underneath the scar, this area of the garment can be an area in between where the garment stops but the breast area begins, and then this area can get very swollen on the top, which is extremely frustrating to people if they have uneven compression in the abdomen because they have a long torso, and then 6 to 12 months later they feel like they're bigger up here and smaller down closer to their hip bones. All that is a big issue that we will have to look at and see, use our skills that we got from our training to see how best to help that person get the best experience with their compression. Okay. So we went over compression. Now let's look at some of the issues I see between the regular liposuction client and the tummy tuck liposuction client. So there will be more concern about that scar because they have a long scar. They're concerned about the scar. So I give everyone a copy of the Plastic Surgery Recovery Handbook. It has a lot of research on scar care and scar healing in that book, so that will help them to have that conversation with their surgeon about how best that they should care for their scar in all stages of that wound healing. But they will be concerned about that scar, concerned about how it's going to fade, when they can put scar cream on, whether they should have steri tape over it, when they should switch to silicone tape. And all these are questions that you will definitely get if you are having abdominoplasty tummy tuck clients. They're also on more medications. So this was actually the big reason why I made the massage after tummy tuck class and got continuing education credits from NCBTMB, so the massage therapists could take this class so they could really see all the things that were going on with these clients so they could feel more confident in helping them. And one of the first things that you see is on that health history form, even before you see them, before that first visit, you're going to have contact with that health history form. You're going to see the different medications they're on. We as the massage therapist need to know, what are the side effects? Why are they taking that medication? Does the medication put them more at risk for feeling dizzy, for feeling nauseous, for having changes in consciousness? We need to know that so we take the right precautions. So we're very careful with our client, both during the massage and when they're getting off the table after the massage. Also, family dynamics. The regular liposuction client, lower incidence of them having small children. If you have a tummy tuck, it's usually because you have small children. Usually people who have massive weight loss will have an extended tummy tuck or a body lift. So the two big things we're seeing with the person coming in with the tummy tuck: do they have a family? Do they have small children? And because they gave birth to a child, then they are looking for the tummy tuck as an operation. So this means how are they dealing with emotions with the children? How are the children accepting it? How have they told their children? Are the children being taken care of so that they can truly heal? And then with massive weight loss, what's going on with their nutritional status after massive weight loss? This is going to have to be something we just remind them to have that discussion with their surgeon and with the primary care physician, that they're getting proper nutrition as they are healing from their body lift. Also, bolstering. Bolstering is huge. We can lie the liposuction client flat on the table and then have them flip over and lay down right on the area where they had liposuction. If they're having a lipo 360, they're laying down on the area of liposuction while we're massaging another area that they had liposuction. But the tummy tuck client, the Brazilian butt lift client, both of those need bolstering. The facelift client, all of those need special bolstering. We just can't treat them like a regular massage client and set up our table just with a pair of sheets and a face cradle or a pillow. So the bolstering, again, was something that I wanted to include in the massage after tummy tuck class, so the massage therapist would be confident in knowing that they're doing the right thing to protect that incision, to protect that surgery from their client. And also, when you have a doctor asking you questions, like if a surgeon was trying to refer clients to you, they may ask questions like, why should they go to you instead of to, any massage therapist? Why should they go to you instead of not having any massage therapists at all and just recovering on their own? And these detailed answers that you can tell them, I do this particular bolster to help them to protect their incision. I do this particular knowledge of how I will know what medications that you might give to them as the surgeon, so I can protect them as they're going in and out of the massage experience. And knowing about the scar care and being able to say, I will reinforce that, they should be wearing the steri strips, and if they have any questions, that they should ask you, their surgeon. And those kind of conversations, if you can have an intelligent conversation like that and know what the answers are that plastic surgeon may ask you about, why are you a good fit for their clients, that is one of the stepping stones to get referrals from plastic surgeons, to build that trust relationship with a surgeon. So I hope this little video has helped you, kind of showed you the top concerns and some of the things that I see with my tummy tuck clients. And if you are a massage therapist, a lymphatic massage therapist, I hope this encourages you to take the massage after tummy tuck class. The link to the class will be in the bio, and once you complete the quiz, you can get continuing education credits from NCBTMB. All right, thank you.